You're doing really good. Go back and forth. She's gonna like wiggle. And actually, I'm feeling now that her left side is tight, so I'm just gonna do a little bit of pressure. My fingers just like that, just like right in here. And that was it right there.
She had chronic ear infections for a while, and so we were getting her adjusted about 3 times a week until we got through that phase.
They pulled him breech out, so he a lot of torque on that upper spine. It's hard on little babies to be born that way, but that's why they come see us, and we make sure it's moving right.
So there has been a growing trend of parents taking their infants to chiropractors for different reasons, for ear infections, for a condition called torticollis, for a condition called colic, or asthma, and the number of visits to the chiropractors has increased. An article in the 2007 issue of Pediatrics showed that more than 30 million people go to the chiropractor every year. In 1998, children and adolescents constituted more than 11% of the total visits to chiropractors. Chiropractors commonly claim to have an effective treatment for asthma, for ear infections, for torticollis, for different allergies. And some chiropractors believe that adjusting the child's spine will help stimulate the immune system to help prevent infection. So, as a disclaimer, I am by no means an expert in this field. I solely have an interest in seeing what the literature says about this particular aspect of medicine. When you see chiropractors online making adjustments to people's spines and to people's backs and to their neck, it makes me cringe at sometimes because of some of these manipulations and with all the dangerous structures that are in these parts of the body. And I know the risks to these adjustments and treatments are really rare, but as a spine surgeon, I have to look at the literature and say, what is the evidence behind these adjustments? And I know I'm going to get a lot of hate comments from people out there, from different chiropractors saying, why do I not believe in this aspect of medicine? Well, it was just something that we weren't taught in medical school. So my goal is to search the literature to see what it says about the evidence behind these adjustments and whether it is an effective treatment for these infants with these ailments. There are lots of different schools of thoughts on this. There's a neurologist at Yale who believes there's absolutely no evidence for this type of adjustments in infants. The American Chiropractic Association supports the use of chiropractic care for these children, but the American Academy of Pediatrics do not have an official stance on chiropractic care for these children. So we're going to watch some of these adjustments and we're going to dive deep into the literature to see what it says. Does the evidence support its use? So this first video is an infant who has visited the chiropractor for colic and constipation. And the chiropractor here states that he is going to adjust the infant's spine to help them with the colic as well as the constipation. Let's check it out.
So this is Sheila, one of our practice members, and she is a new grandma. This is her grandbaby, Winston. So I want you to tell us just a little brief history about his story and what's been going on with him.
The first thing I kind of recognize is that the infant is leaning towards his left side. His head is not really moving. That is a condition called torticollis. It can be caused by a number of different things. There's also another diagnosis, endodifferential, atlantoaxial, rotatory displacement. This is a condition where the top 2 vertebrae, the C1 and C2, they rotate on each other from different causes like infection, trauma, tumors, and most of the torticollis cases are actually caused by a condition to the sternocleidoid mastoid muscle, and it causes the infant to rotate their head to one side or the other.
Well, ever since that he got born, the second day he was born, he has screamed, and no matter who held him, he screamed, and normally an infant does not scream. We gave him 1.5 ounces of formula. He gulped down right away. He was still screaming after that.
He's about a month old now.
He's a month old now.
He hasn't really stopped.
And he has not stopped. And
So there are a lot of parents online and parents in general that take their infants to the chiropractor for colic or for constipation, for different ailments, to see whether the chiropractor can adjust a patient's spine to see if that helps with those conditions.
the doctor has said that he's got colic, and I know colic is like a consistent thing through the night, and his is just random, and when he does an excessive pain.
So infantile colic is a common condition in childhood which can affect up to 1 out of 6 newborns. The condition is characterized by inconsolable crying as well as fussiness in a otherwise healthy and thriving infant.
He only has like one bowel movement. It's really hard.
To the
He
point where they
turns
actually-
like so red in the face, like he's like almost stops breathing.
It's just hard to get the bowel movement out. They took pictures and then they saw the gas from
Gas.
back up in the bowel.
So that is one thing that I'm just not quite sure about, whether someone actually took an x-ray of a 2-month-old baby's belly because they were constipated. That's a lot of x-ray exposure just to check for constipation. It can happen, but I'm not sure. It is something that is just questionable whether that actually happened or not.
You know, the stool's so hard, you actually have to manually remove it before.
And that is pretty common, where a patient comes into the ER, to the hospital, and they're so constipated that a physician or practitioner has to manually de-impact that patient's stool.
See, his head's turned to the right, always, right?
Always.
He's stuck like that.
I know.
That's, I mean, I hate to say just about it, but that's everything right now. Okay, so we're going to check him with our nervous scope here. We just want to see how his nerve system is functioning.
I've never heard of a nervoscope before. Maybe it's something that can test whether the nerves are actually working or not, but never heard of it. You can notice that the infant has actually moved his head from the left side to almost midline, so it's not really a stiff torticollis. He's actually able to correct it himself.
There, buddy. Okay. I know it, bud. I also noticed on there you had said the only time he's really comfortable is when you let his belly hang. Is that right?
It was
It was
last night.
on there.
It didn't work.
How many hours a night does he sleep?
It varies.
Very little, though.
Most infants don't sleep at all. My son sleeps for 1 to 2 hours and wakes up crying, hungry, needs to be changed. Usually until they're a little bit older, most infants don't sleep that much.
Definitely have a big reader right there. That's right on the sacrum. Okay, bud. Let's check the neck out, too. I'll put him on this shoulder over here. We're almost done. Alright, bud. Okay. She's got a big one up there, too. Work that one on. Okay. Give him some love.
Yes.
Okay, so now, what I'd like to do is get you on the high-low here. We're going to have him just stay on you because he's comfortable with you. So we'll have you on your back. Alright?
Okay.
5. 4. Yeah, he doesn't like 4. So I'm going to bring your hand up here. Yep, just like that. So we're going to take a little pressure off of the hips. I'm going to go straight down towards you.
From what I understand, he's checking for vertebral subluxations. The bones in your back are called the vertebral bodies, and you can have a subluxation of these vertebral bodies. And according to chiropractors, any alteration in the form or function of the child may alter the presence of these subluxations. And the presence of these subluxations can alter the way the body functions, or the physiology of the child.
Good job, kiddo. There it goes. Good job. Good job, buddy. There's one. Now we're going to go to T6 here in the mid-back.
T6 is thoracic 6 vertebrae. It's kind of in the upper back. I guess he's feeling for a subluxation at that area.
There, good job.
The infant doesn't really like it too much.
Wait, that
Seems
didn't
like.
take long for him to relax it.
It didn't.
Good job, buddy.
Oh.
That atlas bone is the top bone. It really can affect the brainstem, which affects a lot of our vital functions. But for him, it's shifted over to the right, so his head's actually tilted to the left, but he's rotated to the right as well. So when he's in that car seat, he's like this, looking over to the right, and he doesn't want to turn that head back over to the right though. So we got to shift that back to the left, and then take that rotation back out to line it right. And that should help.
So it looks like he's about to adjust this infant here.
Go ahead and grab
Oh.
him some love.
No,
Wow.
Lord. I think you buried your pants there.
So just because I wasn't trained in this aspect of medicine doesn't mean that it's a part of medicine that can actually help some people. So we're going to turn to the research. I did a thorough literature search review, and I'm going to talk about some of the articles out there that are describing these adjustments and whether these adjustments actually help infants with colic, with constipation, with asthma, with ear infections. So let's go to the research and see what it says. So this first article is for asthma and whether manual therapy actually helps patients with asthma. This was a systematic review in 2005 that looked at whether manual therapy actually helps infants with asthma. And the authors of this study concluded that there is insufficient evidence to support the use of manual therapies for patients with asthma. They suggested conducting a randomized controlled trial that can examine the effects of manual therapies on clinical relevant outcomes. Another study in 2004 looked at chiropractic care in asthma and allergy patients. This was actually a meta-analysis. A meta-analysis is actually looking at a group of articles to see whether the group of articles can support a certain claim. The conclusions out of this article suggested that there's currently no evidence to support the use of chiropractic manual therapy as a primary treatment for asthma or allergy. But what about patients with colic? Can manual therapy help these patients? Does it work? So the first article that I found was a systematic review in 2012, and they reported that the studies in the meta-analysis were small. They were prone to bias because the patients were really not blind, the researchers weren't blind, and it was impossible to draw a conclusion about the effectiveness of manual therapies for patients with infantile colic. Another study in 2012 looking at the efficacy of chiropractic manual therapy on infant colic. This was a single-blind, randomized controlled trial, which is actually the highest level of study. The authors of this study found that manual therapy actually improved crying behavior in patients with colic. But what about torticollis? Can this actually help patients with torticollis? The first study was a Norwegian study in 2018. This was a meta-analysis of 3 randomized controlled trials, as well as 4 observational studies that showed that there was no risk of any serious adverse events, but showed that manual therapy techniques have not been shown to be efficacious in the treatment of patients with infantile torticollis. Another retrospective study in 2018 in the Journal of Chiropractic Medicine showed that infants between 4 and 15 months with newborn torticollis who had manual therapy under anesthesia, they did respond after failing conservative treatment. So they put these patients under general anesthesia, did an adjustment, and these patients actually did well. The downsides of this study was that it was a small patient sample size, it was retrospective, and it was more like a case report. Whether we can extrapolate these results from this study or not remains to be unknown. Another study in 2011, which was a randomized controlled pilot study, This study, the authors concluded that the short-time effect of manual therapy in addition to physiotherapy is not any better than physiotherapy alone. So that's the results for you. Can't argue with evidence. So as a practitioner, I am very curious to see what other people's thoughts are on infants undergoing manual therapy. Personally, I believe that infants during this stage are still growing. They have cartilage and end plates and growth centers that are still going. You have some subluxations that are actually normal in children. And when chiropractors try to reduce these subluxations, I'm not sure if I buy it or not. But just because I didn't learn this in medical school or didn't learn it along my path, I'm trying to put out this video to educate others and to open up discussion from the chiropractors out there. Put it in the comments below. Please send me some articles, send me some evidence. I go off of evidence-based medicine and I go off of what the research says. Unfortunately, there's not a lot of great evidence out there for manual therapy for infants. And whether manual therapy actually helps some patients with asthma or allergies or ear infections or torticollis, well, what does the evidence show? And the evidence is just not there. I have an infant myself, a 3-month-old infant, and I'm just not sure whether I would allow a chiropractor to adjust my baby's spine. The evidence is just not there for it. What are your thoughts? Would you allow a chiropractor to adjust your infant's or your baby's spine? Put it in the comments below. This is Dr. Webb. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them.